So when patients want to know about oocyte freezing or egg freezing, what we tell them is that we have to stimulate their ovaries with injectable medications, grow multiple follicles, remove those oocytes, put them on the laboratory, and then freeze them. On the same day that we remove the eggs, we freeze them for later use. And in most cases, these are patients that are trying to preserve their fertility for a number of reasons. One of the group of patients are the ones undergoing cancer treatments, chemotherapy, radiation therapy, surgeries, so they really don't have any time. And when they are done with the cancer, most of them will have a very compromised fertility potential. There are many other patients that are not ready to become pregnant, and they're in their early 30s or mid 30s. Those are probably the best candidates to freeze their oocytes until they're ready, because if they are close to their 40s or even beyond 40s and now they are ready, the likelihood of pregnancy with the best treatments might be no higher than 15–25%. But if they froze their oocytes at age 30 or 32 or 35, they could accomplish a pregnancy rate at any age of 40, 50, or 60%.
And then we have egg banks. And that's where we recruit volunteers, stimulate them, retrieve their eggs, and freeze these eggs in batches so that they can be used for other couples that need eggs from a donor. All third-party reproduction in the United States is regulated by the Food and Drug Administration. They're screened and tested for infectious diseases according to FDA guidelines. They're screened psychologically, medical history, family history, genetics, and drugs according to the guidelines by the American Society of Reproductive Medicine. It's going to make it a lot easier for couples to come because they don't have to wait for somebody to go through their cycle to be synchronized with them so that they can get the embryos back. In this case, you just fertilize the eggs that are thawed and replace them in the recipient in an artificial cycle.
Oocyte or egg freezing, it is considered an experimental procedure because it requires something called IRB, which is a special review board that will look at the patient's safety and the treatments they're going to be going through, and it's going to make sure that this is done from a scientific point of view without compromising patient care or patient safety.